Hi there, and welcome to the HFS Career Podcast. My name is Dr. Lori Bullock, and I'm an assistant professor at MSU in the Department of Human Development and Family Studies. I teach several courses in the department, and one of them is HDFS 270, which is a course that introduces students to our major and to the field of family science. Quite often, students who are new to our major are not sure of the kinds of career options they have with a degree in human development and family studies. Some students know exactly what they want to do after graduation, and some students aren't sure, and they can often feel sometimes overwhelmed. There are also students who are in this major but plan to pursue careers in healthcare after graduation. These are students who want to be physicians or physician's assistants or nurses or child life specialists or occupational therapists and so on, many of the healthcare fields. The purpose of this podcast is to bring on professionals from many areas that relate to HDFS. Each episode, I invite professionals from the community who have an HDFS background or a background that is similar to HDFS. I'm so excited to have you here today, and I hope the information in this episode will be helpful to you as you consider your career options. I hope you enjoy today's episode. Hello, HDFS students and colleagues. I have a great guest for today's episode, and I'm so excited for you to meet her. Her name is Carla Floyd Slabaugh, and she's an assistant professor in the Department of Occupational Science and Therapy at Grand Valley State University, and the program coordinator for the traditional Masters of Science in Occupational Therapy. She is also the recipient of the 2020 Grand Valley Pew Teaching and Technology Award. Dr. Floyd Slabaugh earned her Bachelor of Science degree as an occupational therapist from Northern Louisiana University in 1991, and she advanced to a clinical doctorate of occupational therapy from Chatham University in 2016. Dr. Floyd Slabaugh's 30-plus years of clinical experience includes pediatric, adult, and older adults with neurological and orthopedic conditions in various settings. Her research interests are primarily related to neurological conditions, concussions, developmental vision, pediatric executive function, physical disabilities, and the scholarship of teaching and learning. She has presented regionally at the Michigan Occupational Therapy Association and the Brain Injury Association of Michigan, and nationally at the American Occupational Therapy Association, and internationally as an invited guest in Zacapa, Guatemala. Dr. Slabaugh, thank you so much for joining my podcast today and for sharing your career experiences. I'm really excited to have you here today and for my students to learn from you.
Well, thank you for the invitation. I'm excited to share about occupational therapy.
Yeah, it's great. We often have students interested in that, and you have come to a campus to speak with our students before, and they have just really enjoyed that. So I really appreciate that. So my first question to you is, can you tell us a little bit about you and your current position and a little bit about occupational therapy?
So occupational therapy, it's changed some through the years. You read my bio that I graduated in 1991. Back in those days, it was a bachelor's level degree. I don't know that I entered college knowing that I wanted to be an occupational therapist. My first love was going to be an elementary school teacher, but I always had an interest in biology and kind of the human body. And so my best friend was in OT, and I kind of went and did what she did. It turned out to be a really good choice for me. I've been very happy with the field and in my what I chose to do. occupational therapy tends to really look at the world and what people are doing and try to get them restored to the things that they want to do, they need to do, or expected to do. So those, you mentioned that I have an interest with those with neurological conditions. So maybe somebody that has a traumatic brain injury or suffered a stroke, they may not have full cognitive capacity after the injury. They may have limitations in their visual capacity along with their physical capacity. So trying to figure out how they can do those things that they want to do, need to do, and are expected to do.
Great, thank you. Appreciate that. So you talked a little bit about it. You said that you know, you didn't know you wanted to do this at first, and so your friend kind of got you into that. Is that what you would consider what the defining experience that led you to pursuing this further? Or are there other things that came along?
It was probably a combination of things. My good friend Cindy and I graduated high school together, and then we were both interested in going to the same college. So our two moms and ourselves, we went on a college visit. And so part of the time we were there, we talked to the College of Education because I was interested in being a teacher. And then we were just kind of along for the ride as she had her time with the OT department. So I think that started with the intrigue to kind of be in that space and hear what they had to say, even though in the moment I didn't necessarily see myself changing. I was very intrigued by all of that. I do
That
think that there was a lot going on leading up to that. Sometimes I'll tell this story of, I think I was in the 8th grade and our family dog was hit by a car, and it had a lot of injury to her hips. And my parents took the dog to the vet and they went through this extensive surgery. But when she came home, she wasn't able to walk well. And so I'd have to pick her up and take her down the stairs for her to go outside. And then I'd have to bring her back in. And just instinctively, when I would come home from school, I would think, God, these legs are just so stiff. And so I'd flip her over and I'd work her legs. And so at the time, I didn't think of doing range of motion. But now looking back, I was performing range of motion. And then she couldn't do those stairs. And so I would take her all the way down the stairs, but I would leave her back legs on that last step so she could hop down. And then there came a time that I would make her do 2 steps and then 3 steps, and she would do that back and forth. And so eventually she was able to be independent. And so I kind of look back on that experience in 8th grade and just think I think I was kind of wired that way.
Yeah, it's funny how you kind of learn that or think back and figure out it was a great fit for you.
Yeah.
Perfect fit. Wow, that's amazing. Amazing. Thank you. Um, so if you what advice do you have for students who might be interested in pursuing a career in occupational therapy? What should they do at the undergraduate level to kind of either learn more about it or get themselves ready to go into a program for that?
um, First of all, to know if you're interested in OT, I think one of the best ways is to spend time around occupational therapists. So if you're able to do observations or speak to other OTs, just taking any opportunity to be in a rehab setting or those kind of settings that OTs may be. I think a common occurrence that we see with students as they're entering the program, there was some point in their life that they knew they were drawn to the medical professions, but they weren't quite sure what was out there, may not have even known that OT was out there. They might know nursing, and there might be something to say, well, like, I appreciate nursing, but that's not quite a fit for me. So spending time in those different medical settings with those professionals, you may be able to see some other discipline that actually is a better match. So really kind of immersing yourself in the learning of what's going on. And part of that learning may be that you find out certain things are not a fit for you, and you may stumble upon something that is a fit for you. I feel
That's a
like there
good.
was a second part to your question.
Oh, well, I do want to comment really quickly, and that's a really good way to point that out or to look at it. We do get a number of students who will work in a nursing home as a CNA to kind of they want to go into nursing, or they feel like they want to go into nursing. And so I have heard how some of them will, while they're working there, they'll see the physical therapists and occupational therapists working there with the clients, and start to get interested there.
Yeah, I
So
think that's that perfect example of kind of immersing yourself in something. You know it. If you're drawn to healthcare, that you're putting yourself in a position, and you'll learn something you didn't even know that was going to come your way.
yeah, it's always exciting when that happens too.
Hmm.
The second part of that was, so if a student does want to pursue, they decide that they do want to pursue it after graduation, how should they go about this? Should they try to make connections at different schools? What do you think? What would you advise their steps be?
That's a really good, so making connections with OTs or people that are connected with where they feel like they want to end up. That's a good route. Also, if you are able to make connections with students who are already in programs, a lot of colleges will have your pre-OT. I think at MSU you have a pre-OT PT program or club. Getting involved with those clubs, that'll help better expand your knowledge base of what the professions are, as well as make connections. So being involved with those clubs associated with your discipline at the college level is a good way. Also, if you know a student that has already been accepted into a program, making those connections, kind of taking some time to talk with them to get their inside view. They're a student in the program, they're where you want to be potentially. So, really making those contacts and developing those relationships to understand what they're going through. At Grand Valley, we have part of our admissions process is what we call an achievement profile. So students are asked to catalog things that they've done, and those go into different categories: things related to practice, leadership, education, research, professional socialization. So really being active. Research could be being a participant in a psychology research project, just kind of answering some questions. Sometimes they're low hanging fruit, but understanding those things, engaging those things is going to build brain capacity and maybe things in your brain that currently are not there. And that professional socialization, that may be contacting other people, making those having an interview or spending time with others. It could also just be maybe being a participant in a relay of life. You're going to find that you're going to be able to mingle with like-minded people, and you never know where those kind of connections are going to lead. Practice, just being active. So you say in maybe taking a position as a CNA because you know that that's kind of close to where you want to be, going to put you in an environment where you could learn something. So all of those things can really lead to a greater understanding of who you are and put you in a position that you can be a match for whatever your next level of education you're seeking.
That's so many great points there. And I think the overall thing it sounds like you're saying is, definitely put yourself out there, of learn different things in different ways and connect with many different places, like you mentioned clubs. And I
Mhm.
guess I didn't realize we had an OTPT club at MSU, so that's really great for our students to know. And just getting involved with those kinds of things, and even things that you think might not be connected, like you said, just kind of reaching out, and then talking with other OTs. And so that's really good to know, and good to know that, how they might look into Grand Valley if they want to, if that is an interest of theirs too. So that's awesome. And it's very much related to what I think my next question is you've talked a little bit about networking, making those connections with people who are OTs, and things like that. There's different ways to network also. Can you talk a little bit about, like, what kinds of organizations do you network with, you yourself as a professional, and what do you recommend that students, what kind of organization should students look into networking if they're interested in occupational therapy?
Now, as a professional, I am a member of different professional organizations. As a practicing OT, I maintain my national board certification. And with that, there is a requirement to attend certain amount of continuing education courses every year. So I get to enjoy going to continuing education. You kind of get credit for those, but you're asked to continue your learning. It's not as though your learning stops when you graduate. You need to continue those things. So I get a chance now to choose what I'm learning instead of these are the classes you have to take. So being involved in continuing education, it is part of a requirement to maintain my licensure, but I really enjoy going to those continuing education. It's a time to speak to other people who have similar interests, and that can be very invigorating. I also am a member of our state OT organization, and they have conferences once a year. That's another thing that I enjoy doing, going to those conferences. They can be, they're going to be within the state, so it can be very accessible to go to a conference like that. In fact, our state conference is often looking for volunteers, so students can go to the Michigan OT Association website and find out where the local conference is. It's each October, and then be able to volunteer their time. And with that, you're kind of surrounded in this environment. You can judge then, is this a fit for me? I think when a bunch of OTs get together, we're really excited to talk all about OT. So it can be, again, a very invigorating experience. As a person that's interested in brain injury, I'm also associated with the Michigan Brain Injury Association. They also have conferences on a regular basis. And so actually next month, I'll be going to their conference that's held each fall, again, to kind of learn more about head injuries and concussions. And I might also present there at different times to try to it's just part of that professional growth. I may be a presenter or kind of getting that information to kind of feed my knowledge base. For students, I think that you can probably attend these various things as well. It's really kind of made for that professional. So once you're in, like when our students are a part of our program, they get a chance to go to conferences as well. Our students may be involved in research projects, and then after they complete their research project, they may actually present the poster on a state level or a national level. Sometimes our students will even have their publications, their manuscript from their research project published. So once you're in a professional program like this, there's, I think, more opportunities to take that next step. For students that aren't quite in an OT program yet, I do think you're kind of at the stage of still wanting to immerse yourself in OT by being with fellow OT students that are interested in applying for a program. When you're in that kind of environment, you get to learn about different programs. Like here in the state, we have a program in the Grand Rapids area from Davenport. We have Western, we have Grand Valley. And so if you're talking to other students, you're able to kind of hear the pluses and minuses. Their admissions process may be different. And so you're really able to kind of build your knowledge base about where you may want to apply and why.
Yeah, you provided so many great tips and so many great ideas for different ways to network, and I think your description of everything also just showed how closely linked professional development and networking are really. It's kind of happens all at the same time, especially when you're going to these professional conferences, and like you said, they can be so invigorating. And I really like the idea that that undergraduates could volunteer to one of those conferences and possibly be able to be immersed and meet some occupational therapists that way. And that would be such a great experience. So you gave a lot of good advice and tips for students who are interested in this, and really appreciate that. And also mentioning, the different programs even within the state that they can compare and choose, what's a good fit for them.
Yeah, and that was just kind of speaking about Grand Rapids. We also have other programs throughout the state, OT programs in Saginaw, and then over toward the Detroit area. And each program can have its own flavor. I kind of sometimes think of if you were given some basic ingredients like tomatoes and ground beef. That could be done in a lot of different ways. Maybe you go on an Italian twist with that, or maybe more of an American twist, or maybe some other kind of culture. And I think that that twist that you put on it is kind of the flavor of each program. And so I think it's good for students to really understand the different programs and find which one is a good fit for them as well.
That's such a good analogy. That's really helpful. I like that. Okay, see what my next question is. Knowing what you know now, what do you wish you had known in college in your early career?
I think sometimes in college you have this maybe self-imposed pressure that you're supposed to pick your major early and then stick with it, that this is who you are. And really, I think, especially in those early years or maybe throughout college, it's a way for you to understand who you are. And sometimes this internal feeling of conflict or maybe not really feeling like you're on the right road can be part of what's happening as you're on the road to self-discovery. Or sometimes that unsettled feeling may be your internal voice saying, this isn't really where you're supposed to be. You're built for something different. And sometimes you can be resistant to that because you're thinking, no, I've already made my choice. I'm on this road over here. I actually have a physical therapy colleague that it's never been her calling. It was not what she was interested in. Her father just said, you really need to pick something that you can make a good living. And so she spent 30 years in a career that is not satisfying to her. Now she's made a good income, and with that, there's some benefits to that. But I think that's really sad for somebody to spend their whole life going to work and never really enjoying that. And so I just think that would be a shame for somebody to do that versus taking the time to self-reflect and really being comfortable with what they're going off into the world to do.
Such a good point. And I do see that with many students that, like you said, the self-imposed pressure. And so when they talk to people like you or see videos like this, they can understand that that's a normal feeling. That's okay to feel like that. And it's okay to not know what you want to do yet.
Mhm.
You might even graduate but find yourself going another path, and that's okay to do that too.
Mhm.
It's okay to
I
change your
can
mind.
understand that sense of pressure though. They feel like the time is clicking semester by semester and there's big dollars involved with going to school. So I can understand why it feels like a big decision. But I would really encourage people to take that time to self-reflect. Sometimes it is just a matter of taking a time out and really thinking about what you're doing and why you're doing it.
I agree. I agree. And to me, it seems from my observations working with students that when you're really feeling struggling and feeling the pressure, then that really is a sign that you do need to kind of just slow down for a minute
Mhm.
and reflect and take maybe a little time out in some way.
Yeah.
And, you know, allow yourself to think that what you're doing now might not be a good fit. Is there something else?
Mhm.
So, really great lessons. And so a little bit back to you, what do you see for yourself in your career and your future? You've been doing this now, like you said, for 30 plus years. What do you see for you?
So I did have a chance to work in the clinic for 30 years. I had a variety of experiences. It was just so wonderful. I worked in inpatient rehab for the first year, and then I was a traveling therapist for the better part of 5 years. My husband and I, before we had children, we got in an RV and had a dog, and I was a traveling therapist. And so
Wow.
every 12 weeks, I would have a different assignment. And so it was just really exciting. Those were exciting years, and taking a lot of continuing education, really investing investing in myself as an OT during those years. And then I was able to then have a family, in which time I kind of rearranged how much I worked and where I worked so that I could have a good balance and take care of the children and, just have that family. That's really what I was wanting at that point. And then when my youngest was starting kindergarten, that's when I went back and advanced my degree. There came a time that I was kind of itchy and hungry again. And so looking for something, it seemed like advancing my degree was a good fit at the time. And that allowed me to then come to Grand Valley and be a professor. So I didn't really see that at the time, but I knew that there was this internal need for something else. And when I made that decision to go back to school, I didn't know that I was going to end up as a professor. So maybe another good example, if for those just starting their college career, I took that path. I didn't know why, but it did really turn out well that now I get to teach at Grand Valley. So that was also kind of happening at the same time that I was spending time in the clinic, and I got to work with individual clients, which I thoroughly enjoy. But there also comes a time in life you kind of want to speak to a broader audience. And so that idea of investing in students that then they can go out, that was going to have a larger impact. And so I think there just came a time in my life that I was looking for that. And I'm really fortunate to be able to be a professor at Grand Valley. We have wonderful students and they're all interested in talking about OT. I love talking about OT. So it's a great fit. I don't know what's going to happen next. I think I'm going to stay here for sure as a professor. And then I get to spend more time on those research interests. Sometimes when you're in the clinic, you're not able to investigate different aspects of clinical care. And being a professor, you do get some time, and we do have research projects that we do with students. And so that's a different outlet that I get to invest my time and effort in that I didn't do as much earlier in my career. So really enjoying these different aspects that have opened up over time.
That's awesome. Sounds like you've had a really fulfilling and rewarding career in
Yeah,
life as an
I feel very
occupational.
fortunate.
Yeah, yeah. Okay, and so my last question is it okay if students contact you if they have any questions? Um,
Absolutely.
okay, and so I'll post the sent some contact information, I think, with your bio.
Mm,
So I'll just post that in the description of this episode.
very good.
All right, thank you. Well,
Thank you,
thank you
Lori.
thank you so much for sharing your wisdom that you've gained, and your experiences and your advice that you have for students. I really appreciate it. I know that's going to be really valuable to them. Thank you so much for joining today's episode of the HGFS podcast. I hope you enjoyed meeting Dr. Carla Floyd Slabaugh and learning about her career journey as an occupational therapist. As I mentioned at the end of the interview, you can find her contact information in the episode description. She would be happy to answer any questions you might have about becoming an occupational therapist. Please join me again soon for interviews with other professionals to learn about the many options that you have available to you. Enjoy the rest of your day.